Question 1. Examination of the data shows a patient admitted to the hospital with complaints of shortness of breath and chest pain. Diagnostic workup, including an electrocardiogram and cardiac enzyme levels, confirmed an acute myocardial infarction. The patient also has a history of chronic obstructive pulmonary disease, COPD, and hypertension, both of which were managed during the admission but were not the primary reason for seeking care. According to U.S. regulatory frameworks for medical coding, which of the following coding approaches best reflects the principal diagnosis? Option A. Code the acute myocardial infarction as the principal diagnosis, followed by codes for COPD and hypertension as secondary diagnoses. Option B. Code chest pain as the principal diagnosis, as it was a significant symptom leading to admission. Option C. Code shortness of breath as the principal diagnosis, as it was the initial presenting symptom. Option D. Code chronic obstructive pulmonary disease, COPD, as the principal diagnosis, given its chronic nature. The correct answer is A. Code the acute myocardial infarction as the principal diagnosis, followed by codes for COPD and hypertension as secondary diagnoses. Explanation. This scenario presents a common challenge in medical billing and coding, accurately assigning ICD-10-CM codes when a patient has multiple coexisting conditions that influence the principal diagnosis. The professional challenge lies in understanding the hierarchical relationship between diagnoses and applying coding guidelines to identify the condition that, after study, occasioned the admission. This requires a deep understanding of the ICD-10-CM official guidelines for coding and reporting, which are paramount for accurate reimbursement and statistical reporting within the U.S. regulatory framework governing healthcare providers. The correct approach involves a thorough review of the medical record to determine the principal diagnosis according to ICD-10-CM Guideline I.B. 4. This guideline mandates that the principal diagnosis is the condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital. In this case, while the patient presented with symptoms of shortness of breath and chest pain, the definitive diagnosis of acute myocardial infarction, established after diagnostic testing, is the condition that necessitated the admission and subsequent treatment. Therefore, coding the acute myocardial infarction as the principal diagnosis, followed by the other conditions as secondary diagnoses, accurately reflects the patient's clinical picture and adheres to coding conventions. An incorrect approach would be to code the symptom that brought the patient to the facility as the principal diagnosis. For example, coding shortness of breath as the principal diagnosis would be a failure to follow ICD-10-CM Guideline I.B. 4, which states that signs and symptoms that are integral to a confirmed diagnosis should not be assigned as separate codes. This leads to inaccurate coding, potentially impacting reimbursement and misrepresenting the primary reason for the patient's care. Another incorrect approach would be to arbitrarily select one of the coexisting conditions without a clear determination of which condition occasioned the admission. This violates the principle of coding based on medical necessity and established diagnostic findings. It also fails to adhere to the hierarchical structure of coding, where the principal diagnosis takes precedence. A third incorrect approach would be to code only the most severe condition without considering if it was the primary reason for admission. While severity is a factor in patient care, the coding guidelines specifically focus on the condition that occasioned the admission. This distinction is critical for accurate data collection and financial reporting. The professional decision-making process for similar situations should begin with a comprehensive review of the entire medical record, including physician documentation, diagnostic test results, and treatment plans. The coder must then consult the ICD-10-CM official guidelines for coding and reporting, paying close attention to sections pertaining to principal diagnosis determination and coding of coexisting conditions. When in doubt, querying the physician for clarification on the principal diagnosis is a crucial step in ensuring accurate coding and maintaining ethical practice. Question 2. Performance analysis shows that a significant number of coding errors stem from the misinterpretation of anatomical descriptors in patient charts. A physician documents a condition affecting the front of the knee. Which of the following anatomical terms most accurately and specifically describes this location for coding purposes? Option A, anterior. Option B, palmar. Option C, dorsal. Option D, ventral. The correct answer is A, anterior. Explanation. This scenario is professionally challenging because accurate anatomical terminology is the bedrock of correct medical coding. Misinterpreting or misapplying anatomical terms can lead to incorrect code assignment, which in turn can result in claim denials, financial penalties, and even patient safety issues if the medical record does not accurately reflect the services rendered. The Certified Billing and Coding Specialist, CBCS, must possess a robust understanding of anatomical nomenclature to ensure compliance with payer guidelines and regulatory requirements, such as those enforced by the Centers for Medicare and Medicaid Services, CMS, in the U.S. The correct approach represents best professional practice because it demonstrates a commitment to accuracy and adherence to established coding standards. By correctly identifying the anatomical location and structures involved in the patient's condition, the coder can select the most precise ICD-10-CM diagnosis codes and CPT procedure codes. This precision is crucial for demonstrating medical necessity, supporting reimbursement, and maintaining the integrity of healthcare data. Adhering to the official coding guidelines and consulting reliable anatomical resources are fundamental ethical and regulatory obligations for a CBCS. An incorrect approach that relies on assumptions or incomplete knowledge of anatomical terms is professionally unacceptable. For example, using a general term when a more specific anatomical term is available and documented in the medical record violates the principle of specificity in coding. This can lead to undercoding or overcoding, both of which have regulatory implications. Failure to consult authoritative sources like the ICD-10-CM official guidelines for coding and reporting or anatomical dictionaries constitutes a breach of professional duty and can result in noncompliance with payer policies and federal regulations. Furthermore, misinterpreting directional terms, e.g., anterior VS, posterior, medial VS, lateral, can lead to coding errors that misrepresent the patient's condition or the services provided, potentially impacting future care decisions and audits. The professional reasoning process for similar situations should involve a systematic approach. 1. Thoroughly review the medical documentation, paying close attention to the physician's notes, operative reports, and diagnostic findings. 2. Identify all documented anatomical terms and their precise meanings. 3. Consult authoritative coding resources, e.g., ICD-10-CM, CPT manuals, official coding guidelines, and anatomical dictionaries or atlases to clarify any ambiguities. 4. Select the most specific and accurate codes that reflect the documented diagnosis and procedures. 5. If documentation is unclear or conflicting, query the provider for clarification before assigning codes. This methodical process ensures accuracy, compliance, and ethical practice. Question 3. The risk matrix shows a heightened probability of payer audits related to durable medical equipment, DME claims. A specific claim involves a patient receiving a power wheelchair. The medical record contains a physician's order for the wheelchair, a detailed evaluation by a physical therapist recommending the specific model, and documentation of patient training. However, billing department has historically used a general HCPCS level Roman II code for power wheelchair, without always cross-referencing the specific model number or associated modifiers. What is the most appropriate course of action for the certified billing and coding specialist? Option A. Omit the HCPCS level Roman II code for the power wheelchair to avoid potential scrutiny, assuming the payer will identify the equipment through other means. Option B. Verify that the specific HCPCS level Roman II code and any required modifiers accurately reflect the power wheelchair model and patient's condition as documented in the medical record, ensuring compliance with Medicare's DME coverage guidelines. Option C. Code the power wheelchair using the most expensive HCPCS level Roman II code available for power wheelchairs, as this is often preferred by suppliers to maximize reimbursement. Option D. Continue using the general HCPCS level Roman II code for power wheelchairs, as this has been the practice and is unlikely to be flagged in a routine audit. The correct answer is B. Verify that the specific HCPCS level Roman II code and any required modifiers accurately reflect the power wheelchair model and patient's condition as documented in the medical record, ensuring compliance with Medicare's DME coverage guidelines. Explanation: this scenario is professionally challenging because it requires a billing and coding specialist to navigate the complexities of HCPCS level Roman II coding in the context of a potential payer audit. The specialist must not only understand the correct coding principles, but also anticipate and address potential areas of scrutiny by the payer, ensuring compliance with Medicare guidelines and preventing fraudulent or erroneous billing. Careful judgment is required to balance accurate coding with the payer's expectations and regulatory requirements. The correct approach represents best professional practice because it prioritizes accurate documentation review and adherence to official coding guidelines and payer policies. By verifying the medical necessity and supporting documentation for the HCPCS level Roman II code, the specialist ensures that the claim is legitimate and compliant with Medicare regulations. This proactive stance minimizes the risk of audit findings, recoupments, and potential penalties, safeguarding both the provider and the integrity of the billing process. An incorrect approach that involves coding based solely on common practice without verifying documentation fails to uphold the principle of accurate representation of services rendered. This can lead to upcoding or unbundling, which are violations of Medicare fraud and abuse statutes. Another incorrect approach, which involves omitting the HCPCS level Roman II code when it is clearly indicated by the documentation, constitutes a failure to accurately report services, potentially leading to underpayment, but also raising red flags for payers if patterns emerge. Coding based on assumptions about payer preference without consulting official guidelines or policies is a significant ethical and regulatory failure, as it deviates from established rules and can result in non-compliance and financial repercussions. Professionals should employ a decision-making framework that begins with a thorough review of the patient's medical record and all supporting documentation. This should be followed by consulting the most current official coding guidelines, payer-specific policies, and relevant regulatory issuances, e.g., Medicare Administrative Contractor Directives. When faced with ambiguity, seeking clarification from supervisors, coding consultants, or directly from the payer is essential. A commitment to continuous education and staying abreast of coding updates is paramount. Question 4. Analysis of a medical record reveals the presence of the abbreviation SOB in the physician's progress note. The coder is unsure if this refers to shortness of breath or son of a bitch, a slang term sometimes used informally. Given the context of a cardiology patient, shortness of breath is the most likely intended meaning. However, the coder needs to ensure the coding is accurate and compliant. Which of the following represents the most appropriate course of action for the certified billing and coding specialist? Option A. Query the physician for clarification of the abbreviation SOB. Option B. Interpret SOB as shortness of breath based on personal medical knowledge and proceed with coding. Option C. Code the encounter for shortness of breath as it is the most probable meaning in a cardiology context. Option D. Assume the abbreviation is acceptable due to its common usage in medical settings and code for shortness of breath. Correct answer is A. Query the physician for clarification of the abbreviation SOB. Explanation. Scenario analysis. This scenario presents a common challenge in medical billing and coding where the interpretation of abbreviations can lead to significant errors in documentation and subsequent claims. The ambiguity of abbreviations, especially those not universally recognized or officially sanctioned, requires a coder to exercise careful judgment to ensure accuracy and compliance. Misinterpreting an abbreviation can result in incorrect coding, leading to claim denials, audits, and potential penalties. Correct approach analysis. The correct approach involves seeking clarification from the healthcare provider when an abbreviation is unclear or non-standard. This aligns with the fundamental principle of accurate medical record documentation and coding. Regulatory guidelines, such as those from the Centers for Medicare and Medicaid Services, CMS, and professional coding organizations like the OPC, which governs the CBCS certification, emphasize the importance of complete and accurate documentation. When an abbreviation is not universally understood or is potentially ambiguous, the provider is the definitive source for its intended meaning. This practice ensures that the code assigned accurately reflects the patient's condition or service rendered, preventing fraud, waste, and abuse. Incorrect approach is analysis. Using a commonly understood meaning for an ambiguous abbreviation without verification is professionally unacceptable because it relies on assumption rather than definitive documentation. This can lead to coding errors that violate the principle of accurate representation of services, potentially resulting in improper payment and non-compliance with payer policies. It bypasses the established process for ensuring documentation integrity, Assuming the abbreviation is acceptable because it is frequently used in the practice is also professionally unacceptable. Frequency of use does not equate to official sanction or universal understanding. Regulatory bodies and payers require clarity and specificity, not just common usage within a single practice. This approach risks misinterpretation and noncompliance with broader coding standards and payer requirements. Coding based on a personal interpretation of the abbreviation without consulting official coding guidelines or the provider is professionally unacceptable. Medical coding requires adherence to established standards and guidelines, e.g., IC 10cm, CPT. Personal interpretation introduces subjectivity and a high risk of error, deviating from the objective application of coding rules and potentially leading to inaccurate claims and compliance issues. Professional reasoning. Professionals should employ a decision-making framework that prioritizes accuracy, compliance, and clear communication. When encountering an ambiguous abbreviation, the process should be: 1. Identify the abbreviation and assess its clarity and standardization. 2. Consult official coding resources, e.g., ICD-10cm Index, CPT Manual for any defined abbreviations. 3. If the abbreviation remains unclear or is not officially defined, the primary recourse is to query the healthcare provider for clarification. 4. Document the clarification received and the rationale for the coding decision. This systematic approach ensures that all coding decisions are based on verifiable information and adhere to regulatory requirements. Question 5. Risk assessment procedures indicate a potential for noncompliance with the Affordable Care Act, ACA, when a patient presents for a service that is considered an essential health benefit. Which of the following actions best ensures adherence to ACA regulations and ethical billing practices? Option A. Bill the patient immediately for the full service amount and address any insurance coverage issues later. Option B. Verify the patient's insurance coverage and understand their specific plan benefits, including cost-sharing requirements for essential health benefits, before determining and communicating the patient's financial responsibility. Option C. Assume the patient is aware of their financial obligations for essential health benefits and proceed with collecting payment without further verification. Option D. Proceed with billing the patient based on standard deductible and copay amounts, assuming all services are subject to these general terms. The correct answer is B. Verify the patient's insurance coverage and understand their specific plan benefits, including cost-sharing requirements for essential health benefits, before determining and communicating the patient's financial responsibility. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a billing and coding specialist to navigate the complex requirements of the Affordable Care Act, ACA, concerning patient financial responsibility and the provision of essential health benefits. Misinterpreting these regulations can lead to improper billing practices, patient dissatisfaction, and potential noncompliance with federal law, impacting both the provider and the patient. The specialist must exercise careful judgment to ensure accurate application of ACA provisions. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient access to care and adherence to ACA mandates. Specifically, it aligns with the ACA's intent to prevent surprise medical bills and ensure transparency in cost-sharing for essential health benefits. By verifying coverage and understanding the patient's financial obligations within the framework of their specific plan and the ACA's essential health benefits, the specialist ensures that the patient is not improperly billed for services that should be covered or subject to incorrect cost-sharing. This approach upholds ethical billing standards and regulatory compliance. Incorrect approach is analysis. One incorrect approach fails by assuming all services are subject to standard deductibles and copays without considering ACA provisions for essential health benefits. This overlooks the ACA's requirement that certain preventive services and other essential benefits may have different cost-sharing structures, potentially leading to incorrect patient billing and a violation of ACA mandates. Another incorrect approach is to proceed with billing without verifying the patient's insurance coverage and understanding their specific plan benefits. This is a significant regulatory failure, as it bypasses the fundamental steps required for accurate billing under any insurance framework, including the ACA, and can lead to incorrect charges and disputes. A further incorrect approach involves prioritizing the immediate collection of payment over understanding the patient's financial responsibility as defined by the ACA and their insurance plan. This demonstrates a lack of ethical consideration for the patient's financial well-being and a failure to comply with the ACA's consumer protection aspects. Professional reasoning. Professionals should employ a decision-making framework that begins with understanding the specific regulatory landscape. In this case, the ACA. This involves identifying the type of service being rendered, determining if it falls under essential health benefits, and then verifying the patient's insurance coverage and plan details. The next step is to accurately calculate the patient's financial responsibility based on their plan's deductible, copay, coinsurance, and any out-of-pocket maximums, always in conjunction with ACA guidelines. Transparency with the patient regarding their estimated financial responsibility is crucial. If there is any ambiguity, seeking clarification from the payer or a supervisor is a necessary step before finalizing billing. Question 6. Quality control measures reveal a billing specialist has coded a patient encounter for nephrolithiasis using a code for a kidney infection. The physician's documentation clearly states the presence of kidney stones. The billing specialist's rationale was that itis in the term implies an inflammatory process, which they associated with infection. Analyze the accuracy of this coding decision based on the understanding of medical terminology and U.S. healthcare billing regulations. Option A. The billing specialist correctly identified the inflammatory component but failed to accurately interpret the root word, leading to an incorrect code assignment for a kidney infection instead of kidney stones. Option B. The billing specialist correctly interpreted the root word and suffix, leading to the accurate coding of kidney stones as documented. Option C. The billing specialist correctly identified the prefix and suffix, leading to the accurate coding of a kidney infection. Option D. The billing specialist correctly identified the inflammatory component, but overlooked the specific meaning of the root word, resulting in an inaccurate code for a kidney infection. The correct answer is A. The billing specialist correctly identified the inflammatory component but failed to accurately interpret the root word, leading to an incorrect code assignment for a kidney infection instead of kidney stones. Explanation. Scenario analysis. This scenario presents a professional challenge because inaccurate medical record documentation directly impacts the accuracy of billing and coding. Misinterpreting or misapplying prefixes, suffixes, and root words can lead to incorrect code assignment, potentially resulting in undercoding, financial loss for the provider, or overcoding, fraudulent billing. The challenge lies in ensuring the coder possesses the linguistic and medical knowledge to accurately decipher the physician's documentation and translate it into the correct ICD-10-CM and CPT codes, adhering strictly to the Certified Billing and Coding Specialist (CBCS) exam's regulatory framework, which emphasizes accurate representation of services rendered. Correct approach analysis. The correct approach involves a systematic breakdown of the medical term to identify its core meaning. This requires understanding that nephr refers to the kidney, itis signifies inflammation, and lith denotes a stone. Combining these, nephrolithiasis accurately translates to a condition of kidney stones. A CBCS professional must then cross-reference this understanding with official coding guidelines and the ICD-10-CM tabular list to select the most specific and appropriate code for kidney stones, ensuring compliance with U.S. federal regulations governing healthcare billing and coding, such as those enforced by the Centers for Medicare and Medicaid Services, CMS. This meticulous process upholds the integrity of medical records and billing, preventing both financial discrepancies and potential compliance violations. Incorrect approaches analysis. One incorrect approach is to assume nephrolithiasis refers to a general kidney infection simply because itis can indicate inflammation. This overlooks the specific meaning of lith and leads to assigning a code for pyelonephritis or another infection, which is a misrepresentation of the documented condition. This failure violates the principle of accurate coding and could lead to improper reimbursement and potential audits. Another incorrect approach is to focus solely on the prefix nephr and assign a code for a general kidney disorder without considering the suffix or root word. This results in a lack of specificity, which is contrary to the ICD-10-CM coding convention of using the most specific code available. This can lead to undercoding and failure to capture the full clinical picture, impacting quality reporting and reimbursement. A third incorrect approach is to guess the meaning of the term based on its sound or common usage without consulting medical dictionaries or coding resources. This is a direct violation of professional standards and regulatory requirements for accurate coding. Relying on assumptions rather than evidence-based interpretation can lead to significant coding errors, jeopardizing the provider's compliance status and the coder's professional credibility. Professional reasoning. Professionals should approach medical terminology by first identifying the root word, then the suffix, and finally the prefix. This systematic dissection allows for a precise understanding of the medical condition. When encountering unfamiliar terms, it is imperative to consult authoritative medical dictionaries and the official ICD-10-CM and CPT coding manuals. If documentation remains unclear or ambiguous, the professional coder must query the physician for clarification before assigning any codes. This iterative process of analysis, verification, and if necessary, clarification ensures accurate and compliant coding practices, aligning with the ethical obligations and regulatory mandates of the CBCS profession within the U.S. healthcare system. Question 7. Research into a patient's Medicare and Medicaid eligibility reveals conflicting information at the time of service for a scheduled non-urgent procedure. The billing and coding specialist must decide how to proceed with the claim submission. Which of the following actions best adheres to Medicare and Medicaid regulations? Option A. Bill the patient directly for the procedure, as the eligibility is uncertain. Option B. Delay the scheduled procedure until definitive eligibility confirmation is obtained. Option C. Attempt to verify eligibility through available resources, and if unsuccessful, contact the patient for clarification before proceeding with the claim or service. Option D. Submit the claim to Medicare and Medicaid, and if denied, then pursue patient payment. Correct answer is D. Submit the claim to Medicare and Medicaid, and if denied, then pursue patient payment. Explanation. This scenario presents a common challenge in medical billing and coding, ensuring compliance with Medicare and Medicaid regulations when a patient's eligibility status is unclear at the time of service. The professional challenge lies in balancing the need to provide timely care with the imperative to accurately bill government programs, avoiding potential fraud, waste, and abuse. Careful judgment is required to determine the appropriate course of action without jeopardizing patient care or violating regulatory requirements. The correct approach represents best professional practice because it prioritizes obtaining accurate eligibility information before submitting a claim to Medicare or Medicaid. This aligns with the fundamental principle of Medicare and Medicaid billing, which requires that services rendered must be medically necessary and provided to an eligible beneficiary. By verifying eligibility, the billing and coding specialist ensures that the claim is submitted to the correct payer and that the patient is not billed inappropriately for services that should be covered by Medicare or Medicaid. This proactive step prevents claim denials, reduces the likelihood of overpayments, and maintains the integrity of the billing process. An incorrect approach that involves submitting the claim without verifying eligibility and assuming coverage is a significant regulatory failure. Medicare and Medicaid have specific rules regarding beneficiary eligibility and the types of services covered. Submitting a claim without confirming eligibility can lead to billing a program that is not responsible for the service, potentially resulting in a false claim. This could be considered fraud or abuse, as it misrepresents the circumstances of the service. Another incorrect approach, which is to bill the patient directly for the service without attempting to verify Medicare or Medicaid eligibility, is also a regulatory failure. Medicare and Medicaid have specific rules about balance billing, and when providers can bill patients directly. If a patient is believed to be eligible for Medicare or Medicaid, providers are generally prohibited from billing the patient for services that should be covered by these programs, unless specific conditions are met, e.g., the patient has signed an advance beneficiary notice for a non-covered service. This action bypasses the proper payer and can lead to improper patient charges. A third incorrect approach, which is to delay services until eligibility is confirmed, might seem cautious but can be detrimental to patient care, especially in urgent situations. While confirming eligibility is crucial, the regulatory framework often allows for reasonable efforts to verify eligibility post-service, particularly in emergency or urgent care scenarios, with a time frame for subsequent verification. The failure here is not in the intent to verify, but in the absolute cessation of care without considering established protocols for urgent situations. The professional decision-making process for similar situations should involve a tiered approach. First, Attempt to verify eligibility through available electronic systems or by contacting the patient. If immediate verification is not possible, assess the urgency of the service. For non-urgent services, delay the service until eligibility is confirmed. For urgent or emergency services, proceed with rendering the service while making diligent efforts to verify eligibility as soon as reasonably possible. Once eligibility is determined, submit the claim to the correct payer. If the patient is found to be ineligible for Medicare or Medicaid, then proceed with billing the patient directly, ensuring all appropriate patient notification and consent procedures are followed. Question 8. The assessment process reveals a physician's documentation for a patient stating stage 3 pressure ulcer of the sacrum. Which ICD-10-CM code accurately reflects this documentation according to the highest level of specificity? Option A, L89, 150 pressure ulcer of sacrum, unspecified depth. Option B, L89, 153 pressure ulcer of skin, stage 3 sacral region. Option C, L89, 153 pressure-induced deep tissue injury, sacral region. Option D, L89, 153 pressure ulcer with third degree, sacral region. The correct answer is C, L89, 153 pressure-induced deep tissue injury, sacral region. Explanation: scenario analysis. This scenario presents a common challenge in medical coding where a patient's condition has multiple documented aspects, requiring the coder to determine the most accurate and specific ICD-10-CM code. The professional challenge lies in interpreting the physician's documentation to ensure compliance with coding guidelines, specifically the principle of coding to the highest level of specificity. Misinterpretation can lead to inaccurate billing, potential claim denials, and noncompliance with payer requirements, impacting both the provider's reimbursement and the patient's record accuracy. Correct approach analysis. The correct approach involves carefully reviewing the physician's documentation to identify all relevant clinical details. In this case, the physician has documented both the presence of a pressure ulcer and its specific stage. ICD-10-CM guidelines mandate coding to the highest level of specificity available in the documentation. Therefore, selecting the code that reflects the documented stage of the pressure ulcer is the best professional practice, as it provides a more precise clinical picture and meets payer expectations for detailed coding. This aligns with the fundamental principles of ICD-10-CM coding and the need for accurate representation of patient conditions. Incorrect approach is analysis. One incorrect approach would be to select a code for a pressure ulcer without specifying the stage. This fails to adhere to the ICD-10-CM coding guideline of coding to the highest level of specificity. It provides less clinical detail than is available in the documentation, potentially leading to underreporting of the severity of the condition and noncompliance with payer requirements that often necessitate stage-specific coding for pressure ulcers. Another incorrect approach would be to select a code for a pressure ulcer of a different, unspecified stage or a more general category if a specific stage is documented. This directly contradicts the physician's documented findings and the ICD-10-CM requirement for specificity. It misrepresents the patient's condition and can lead to significant coding errors, claim rejections, and potential audits. A further incorrect approach might involve selecting a code based on assumptions or information not explicitly documented by the physician, such as inferring a stage based on treatment provided. This violates the core principle of coding based solely on documented evidence, introducing a significant ethical and regulatory failure. Coders must code what is documented, not what they presume. Professional reasoning. Professionals should approach this situation by first thoroughly reading and understanding the physician's complete documentation. They should then consult the ICD-10-CM official guidelines for coding and reporting, paying close attention to guidelines related to pressure ulcers and the principle of highest specificity. If any ambiguity exists, the coder should query the physician for clarification before assigning a code. This systematic process ensures accuracy, compliance, and ethical practice. Question 9. The performance metrics show a significant increase in claim denials attributed to insufficient medical necessity documentation for specific procedures. As a certified billing and coding specialist, what is the most appropriate initial course of action to address this trend? Option A. Inform the physician that all claims for these procedures will be automatically denied going forward until their documentation improves, without further investigation. Option B. Advise the physician to simply add more descriptive terms to the patient's chart, even if those terms are not directly supported by the clinical encounter notes. Option C. Immediately escalate the issue to the compliance department, requesting an audit of all claims submitted by the physician for the past 6 months. Option D. Schedule a meeting with the physician to review the denial trends, discuss specific documentation requirements for the affected procedures, and collaboratively identify strategies to improve future documentation. Correct answer is D. Schedule a meeting with the physician to review the denial trends, discuss specific documentation requirements for the affected procedures, and collaboratively identify strategies to improve future documentation. Explanation. The performance metrics show a concerning trend in claim denials related to medical necessity documentation. This scenario is professionally challenging because it directly impacts the financial health of the healthcare organization and, more importantly, raises ethical questions about patient care and accurate billing. The billing and coding specialist must navigate the complexities of payer policies, physician documentation, and regulatory requirements to ensure claims are submitted correctly and ethically. The correct approach involves a proactive and collaborative strategy. By initiating a review of denial trends and engaging with the physician to understand documentation gaps, the specialist demonstrates a commitment to compliance and ethical billing practices. This approach aligns with the principles of accurate coding, which requires complete and accurate documentation to support the services rendered. It also upholds the ethical obligation to bill only for services that are medically necessary and properly documented, as required by payers and federal regulations like the False Claims Act. This collaborative review process helps identify systemic issues and implement corrective actions, thereby preventing future denials and potential compliance violations. An incorrect approach would be to ignore the denial trends, assuming they are solely the responsibility of the physician or the payer. This demonstrates a lack of diligence and a failure to uphold professional responsibilities. It also risks continued financial losses and could be interpreted as a willful disregard for compliance, potentially leading to accusations of fraudulent billing if patterns of non-compliance are established. Another incorrect approach is to immediately implement punitive measures against the physician without understanding the root cause of the documentation deficiencies. This can damage the professional relationship, create an adversarial environment, and fail to address the underlying issues effectively. Ethically, it is important to approach such situations with a focus on education and improvement rather than immediate blame. Finally, an incorrect approach would be to simply resubmit claims without addressing the documentation issues. This is a direct violation of payer policies and federal regulations, as it constitutes billing for services without adequate support. It is a form of misrepresentation and can lead to severe penalties, including recoupment of payments and exclusion from federal healthcare programs. The professional reasoning process in such a situation should involve 1. Data analysis to identify trends and patterns. 2. Communication and collaboration with relevant parties, physicians, compliance officers. 3. Root cause analysis to understand why denials are occurring. 4. Development and implementation of corrective action plans, including education and process improvements. 5. Ongoing monitoring to ensure the effectiveness of the implemented solutions. This systematic approach ensures that compliance and ethical standards are maintained while also addressing operational challenges. Question 10. Which approach would be most effective in improving the long-term revenue cycle performance of a medical practice experiencing a high volume of claim denials due to various reasons, including incorrect coding, lack of prior authorization, and registration errors? Option A. Writing off all denied claims after a predetermined period without investigating the reasons for denial to reduce administrative workload. Option B. Implementing a comprehensive denial trend analysis to identify root causes and develop targeted corrective actions, followed by ongoing monitoring of denial rates and denial reasons. Option C. Focusing solely on appealing each denied claim individually, ensuring all necessary documentation is submitted for each appeal to maximize recovery. Option D. Training the billing staff to be more proficient in navigating payer websites to resubmit corrected claims without addressing the underlying systemic issues causing the initial denials. The correct answer is B. Implementing a comprehensive denial trend analysis to identify root causes and develop targeted corrective actions, followed by ongoing monitoring of denial rates and denial reasons. Explanation. This scenario presents a common challenge in revenue cycle management, identifying and addressing root causes of claim denials rather than just processing appeals. The professional challenge lies in moving beyond reactive problem solving to proactive system improvement. Careful judgment is required to distinguish between superficial fixes and sustainable solutions that impact financial health and compliance. The correct approach represents best professional practice because it aligns with the principles of efficient revenue cycle management and adherence to payer regulations. By analyzing denial trends, a billing and coding specialist can identify systemic issues such as incorrect coding, incomplete documentation, or registration errors. Addressing these root causes prevents future denials, reduces administrative burden, and ensures accurate reimbursement, which is critical for the financial viability of the healthcare provider. This proactive stance also demonstrates a commitment to compliance with payer policies and federal regulations like the False Claims Act, which prohibits knowingly submitting false claims. An incorrect approach that focuses solely on appealing individual denials fails to address the underlying problems. This leads to a continuous cycle of denials and appeals, consuming significant resources without improving overall performance. It can also indicate a lack of understanding of payer requirements and coding guidelines, potentially leading to repeated errors and increased scrutiny from payers. Another incorrect approach, which involves writing off denied claims without investigation, is professionally unacceptable. This practice directly impacts revenue and can mask significant coding or billing errors. It suggests a lack of diligence and a failure to uphold the provider's responsibility to seek appropriate reimbursement for services rendered. Furthermore, it can lead to a misrepresentation of the provider's financial performance and may violate payer contracts that require diligent follow-up on denied claims. The professional reasoning process for similar situations should involve a systematic approach to denial management. This includes 1. Categorizing denials to identify trends. 2. Investigating the root cause of common denial categories. 3. Implementing corrective actions at the source of the problem, e.g., training, process changes, system edits. 4. Monitoring the effectiveness of corrective actions. 5. Regularly reviewing payer policies and updating internal processes accordingly. This framework ensures that denial management is not just a task, but a strategic function that drives continuous improvement in revenue cycle performance and compliance. Question 11. The review process indicates that a claim was submitted with a patient's date of birth entered incorrectly and without confirming the patient's current insurance coverage for the date of service. Which of the following actions, if taken by the billing and coding specialist, would represent the most appropriate and compliant approach to claim submission? Option A. Forward the claim to the payer with a separate document detailing the suspected insurance coverage issues. Option B. Submit the claim as is, assuming the payer will request corrected information if needed. Option C. Correct the patient's date of birth and verify current insurance eligibility before resubmitting the claim. Option D. Immediately resubmit the claim with the incorrect date of birth, but with a note indicating a potential error. The correct answer is C. Correct the patient's date of birth and verify current insurance eligibility before resubmitting the claim. Explanation. This scenario is professionally challenging because it requires the billing and coding specialist to navigate the complexities of payer-specific claim submission requirements while ensuring compliance with federal regulations like HIPAA and the False Claims Act. The specialist must balance the need for efficient claim processing with the imperative to submit accurate and complete information to avoid denials, audits, and potential penalties. The correct approach represents best professional practice because it prioritizes accurate data entry and adherence to payer guidelines, which are fundamental to successful claim submission. By verifying all required fields and ensuring the claim aligns with the payer's specific electronic submission format or paper submission instructions, the specialist minimizes the risk of rejection and ensures timely reimbursement. This proactive verification directly supports the integrity of the billing process and upholds the provider's financial health. An incorrect approach that involves submitting a claim with incomplete demographic information is a regulatory failure. HIPAA mandates the protection of protected health information, FI, and incomplete or inaccurate demographic data can lead to misidentification of the patient, potentially compromising their PHI and leading to billing errors. Furthermore, submitting claims with known deficiencies can be construed as a violation of the False Claims Act, as it involves presenting false or fraudulent claims for payment. Another incorrect approach, submitting a claim without verifying the patient's current insurance eligibility, is a failure to exercise due diligence. This can result in claims being denied due to the patient not having active coverage at the time of service, leading to increased administrative burden for resubmission and potential write-offs for the provider. Ethically, it is a disservice to both the patient and the provider to proceed with billing without confirming coverage. Submitting a claim with a generic diagnosis code when a more specific code is available, without proper documentation to support the generic code, is a significant coding and billing failure. This misrepresents the patient's condition and can lead to improper payment. It violates the principle of accurate coding, which requires the use of the most specific and appropriate ICD-10-CM code supported by the medical record, and can be a violation of the False Claims Act if it results in overpayment. The professional decision-making process for similar situations should involve a systematic review of the claim against established protocols. This includes verifying patient demographics, insurance eligibility, medical necessity documentation, and coding accuracy. When in doubt, consulting payer-specific guidelines, internal policies, or seeking clarification from supervisors or coding experts is crucial. The ultimate goal is to ensure that every claim submitted is accurate, complete, and compliant with all applicable regulations and payer requirements. Question 12. The analysis reveals that a medical practice is considering outsourcing its billing operations to a third-party vendor. The practice has identified several potential vendors and is evaluating their proposals. Which of the following approaches best aligns with the regulatory framework for protecting patient health information and ensuring compliant billing practices? Option A. Partnering with a vendor that provides a broad overview of their security measures, but is hesitant to sign a BAA, citing that their internal policies are sufficient for protecting patient data. Option B. Opting for a vendor that offers to transmit patient demographic and insurance information via standard, unencrypted email for expediency, as this is a common industry practice. Option C. Choosing the vendor with the lowest bid, assuming that all reputable billing services inherently comply with healthcare regulations without requiring explicit verification or contractual agreements. Option D. Selecting a vendor that demonstrates robust data encryption protocols for all data in transit and at rest, has a comprehensive security risk management plan, and is willing to sign a business associate agreement, BA, outlining specific HIPAA compliance obligations. The correct answer is D. Selecting a vendor that demonstrates robust data encryption protocols for all data in transit and at rest, has a comprehensive security risk management plan, and is willing to sign a business associate agreement, BA, outlining specific HIPAA compliance obligations. Explanation. The analysis reveals a common challenge in medical billing and coding, navigating the complexities of patient privacy and data security in the context of electronic health records, AIR, and third-party billing services. The professional challenge lies in balancing the need for efficient billing operations with the stringent requirements of HIPAA, specifically the privacy rule and the security rule. Ensuring compliance requires a thorough understanding of what constitutes protected health information, PHI, and the appropriate safeguards necessary for its transmission and storage. The correct approach represents best professional practice because it prioritizes patient privacy and data security by implementing robust technical, physical, and administrative safeguards as mandated by HIPAA. This includes ensuring that any third-party vendor handling PHI has a business associate agreement, BA, in place, which legally obligates them to protect the PHI. Furthermore, it emphasizes the importance of encryption for data in transit and at rest, regular security risk assessments, and comprehensive employee training on HIPAA compliance. This proactive and comprehensive strategy minimizes the risk of breaches and ensures adherence to federal regulations. An incorrect approach that involves transmitting patient billing information via unencrypted email to a third-party billing service fails to meet the minimum security standards required by HIPAA. Unencrypted email is inherently insecure and susceptible to interception, constituting a significant breach of patient privacy and a violation of the HIPAA security rule. This action exposes PHI to unauthorized access, leading to potential identity theft and financial fraud for the patient, and exposing the healthcare provider to substantial penalties and reputational damage. Another incorrect approach, which involves sharing patient demographic and insurance information with a billing service without verifying their HIPAA compliance or establishing a BAA, is also professionally unacceptable. This oversight bypasses a critical legal requirement for safeguarding PHI when it is shared with external entities. Without a BAA, the third-party vendor is not contractually bound to protect the PHI according to HIPAA standards, creating a significant vulnerability. This failure to conduct due diligence and establish a formal agreement directly contravenes the intent and mandates of the HIPAA privacy rule. The professional decision-making process for similar situations should begin with a thorough understanding of the specific regulatory requirements. In this case, HIPAA. Professionals must identify all potential risks to PHI throughout the billing and coding lifecycle, from data entry to transmission and storage. This involves a risk assessment process to pinpoint vulnerabilities. When engaging with third-party vendors, it is imperative to conduct due diligence, ensuring they have appropriate security measures in place and are willing to enter into a BAA. All data transmissions involving PHI must utilize secure, encrypted methods. Regular training and ongoing monitoring of compliance are essential to maintain a secure and legally compliant billing operation. Question 13. The evaluation methodology shows that a new patient presents for a scheduled appointment with a referral from a specialist. The registration desk has collected the patient's insurance card, which indicates Blue Cross Blue Shield of Texas. However, the patient states they also have a secondary insurance with Aetna. The billing and coding specialist needs to determine the primary and secondary payers and the type of plan each represents to ensure correct claim submission. Option A. Bill the patient as self-pay for the entire service, as the presence of multiple insurance plans creates too much complexity for accurate billing. Option B. Bill the services to Blue Cross Blue Shield of Texas as the primary payer, and then bill Aetna as the primary payer for any remaining balance, regardless of coordination of benefits. Option C. Assume Blue Cross Blue Shield of Texas is the primary payer, and Aetna is the secondary payer based on the order they were mentioned, and proceed with billing accordingly. Option D. Verify the primary and secondary insurance information by checking the patient's insurance cards and cross-referencing with the payer's online portals, or by phone to confirm plan types and coverage details. The correct answer is D. Verify the primary and secondary insurance information by checking the patient's insurance cards and cross-referencing with the payer's online portals, or by phone to confirm plan types and coverage details. Explanation. The evaluation methodology shows that understanding the nuances of different health insurance plans is crucial for accurate billing and coding. This scenario is professionally challenging because a billing and coding specialist must correctly identify the patient's insurance plan to ensure proper claim submission and reimbursement, avoiding denials and potential financial repercussions for both the patient and the provider. Misidentification can lead to incorrect coding, billing to the wrong payer, and ultimately, claim rejections. The correct approach represents best professional practice because it involves a systematic and thorough review of all provided documentation to accurately determine the patient's insurance coverage. This aligns with the core responsibilities of a certified billing and coding specialist, CBCS, to maintain accurate patient records and submit claims in accordance with payer guidelines. Specifically, identifying the plan type e.g., PPO, HMO, EPO, dictates the network status of the provider, referral requirements, and prior authorization needs, all of which are critical for compliant billing. Adhering to these details ensures that claims are processed efficiently and correctly, minimizing errors and maximizing reimbursement. An incorrect approach that involves assuming the plan type based on a provider's network status without explicit documentation is a significant regulatory and ethical failure. This assumption bypasses the requirement for verification and can lead to submitting claims to a payer that is not responsible for the service, violating payer contracts, and potentially leading to fraud allegations. Another incorrect approach, such as billing as a self-pay patient when insurance is present, is also a failure. This not only misrepresents the patient's financial responsibility, but also prevents the provider from seeking appropriate reimbursement from the insurance carrier, which is a breach of contract and ethical duty. Finally, relying solely on the patient's verbal confirmation without cross-referencing with insurance cards or other official documentation is risky. While patients may have good intentions, their understanding of their plan details can be incomplete or inaccurate, leading to billing errors. This failure to verify official documentation is a lapse in due diligence and can result in non-compliance with payer rules. Professionals should employ a decision-making framework that prioritizes verification and documentation. When presented with patient registration information, the first step is to meticulously review all provided insurance cards and any accompanying paperwork. If there is any ambiguity or missing information, the next step is to contact the patient directly for clarification or request additional documentation. In a professional setting, it is always best practice to confirm the insurance plan type and eligibility through the payer's online portal or by phone, cross-referencing this information with the patient's provided documentation before submitting any claims. This multi-layered verification process ensures accuracy and compliance. Question 14. Process analysis reveals a consistent pattern of delayed payments for a significant portion of claims submitted by a medical practice. Initial review of the claims that have been rejected or denied shows that the primary reason for these issues is not related to coding errors or medical necessity, but rather to problems with the patient's insurance information. What is the most appropriate initial course of action for the certified billing and coding specialist to take to address this revenue cycle breakdown? Option A. Immediately escalate the issue to the coding department to review their accuracy in assigning diagnosis and procedure codes. Option B. Focus on expediting the resubmission of all rejected and denied claims to minimize the time to payment. Option C. Conduct a thorough audit of the patient registration process to ensure accurate capture and verification of insurance details at the point of service. Option D. Advise the practice manager to contact the payers directly to inquire about potential processing delays. The correct answer is C. Conduct a thorough audit of the patient registration process to ensure accurate capture and verification of insurance details at the point of service. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a billing and coding specialist to identify a breakdown in the revenue cycle that directly impacts claim submission and reimbursement. The specialist must understand the interconnectedness of patient registration, insurance verification, coding accuracy, and claim submission to pinpoint the root cause of delayed payments. Failure to accurately identify this bottleneck can lead to prolonged denial cycles, increased administrative burden, and ultimately, financial loss for the healthcare provider. Correct approach analysis. The correct approach involves meticulously reviewing the patient registration process, specifically focusing on the accuracy and completeness of insurance information captured at the point of service. This is the foundational step in the revenue cycle. If insurance details are incorrect or missing, subsequent steps like eligibility verification, accurate coding based on payer policies, and claim submission will be compromised, leading to rejections and denials. Adhering to payer guidelines and internal protocols for patient registration ensures that claims are submitted with the correct information, maximizing the likelihood of timely and accurate reimbursement. This aligns with the core principles of revenue cycle management, which emphasize efficiency and accuracy from the outset. Incorrect approach is analysis. One incorrect approach is to immediately focus on the coding department's accuracy without first verifying the patient's insurance information. This is a regulatory failure because it bypasses a critical upstream process. Inaccurate insurance data at registration will lead to claims being sent to the wrong payer or being rejected for eligibility issues, regardless of coding accuracy. This approach also violates ethical practice by potentially blaming another department without proper investigation. Another incorrect approach is to assume the issue lies solely with the payer's processing time without investigating internal workflows. While payer delays can occur, a consistent pattern of delayed payments suggests an internal systemic problem. This approach fails to uphold the professional responsibility of a billing and coding specialist to identify and resolve internal inefficiencies that hinder revenue collection. It also neglects the regulatory requirement to actively manage the revenue cycle and ensure claims are submitted correctly and promptly. A third incorrect approach is to prioritize claim resubmission over identifying the root cause of the initial rejection. While resubmission is necessary, it is a reactive measure. Without understanding why the claim was rejected, the same errors are likely to be repeated, perpetuating the problem and increasing administrative costs. This demonstrates a lack of deep analytical skill and a failure to implement sustainable solutions, which is a professional deficiency in revenue cycle management. Professional reasoning. Professionals should approach revenue cycle issues by adopting a systematic top-down analysis. Start with the earliest stages of the revenue cycle: patient registration, insurance verification, and move sequentially through coding, claim submission, payment posting, and denial management. When a problem arises, trace it back to its origin. Document all findings and actions taken. Regularly review key performance indicators, KPI, related to the revenue cycle to proactively identify trends and potential issues before they escalate. This methodical approach, grounded in understanding regulatory requirements and best practices for revenue cycle management, ensures that problems are addressed effectively and efficiently, leading to improved financial outcomes for the healthcare provider. Question 15. During the evaluation of a patient encounter, a certified billing and coding specialist is tasked with determining the appropriate coding system to utilize for documenting both the patient's condition and the services rendered. The specialist must ensure that the chosen coding approach aligns with regulatory requirements for accurate claim submission and reimbursement. Which of the following approaches best reflects the fundamental principles of medical coding systems as applied in the United States for this purpose? Option A. Select a single coding system that can encompass both diagnostic and procedural information for all encounter types. Option B. Apply ICD-10-CM codes for reporting diagnoses and CPT codes for reporting procedures and services. Option C. Utilize ICD-10-CM codes to describe the specific medical procedures performed during the encounter. Option D. Employ CPT codes to report the patient's diagnoses and underlying medical conditions. The correct answer is C. Utilize ICD-10-CM codes to describe the specific medical procedures performed during the encounter. Explanation. This scenario is professionally challenging because it requires the billing and coding specialist to navigate the fundamental differences between two major coding systems used in healthcare, understanding their distinct purposes and applications. Accurate coding is paramount for proper reimbursement, statistical analysis, and compliance with healthcare regulations. Misinterpreting the application of these systems can lead to significant financial penalties, audit failures, and inaccurate patient record data. The correct approach represents best professional practice because it demonstrates a thorough understanding of the foundational principles of medical coding and the specific roles of different coding systems. By correctly identifying the primary purpose of ICD-10-CM for diagnosis reporting and CPT for procedure reporting, the specialist ensures that claims are submitted accurately, meeting regulatory requirements for specificity and completeness. This adherence to the intended use of each system is critical for compliant billing and coding, directly impacting revenue cycle management and patient care documentation. An incorrect approach that focuses solely on procedure codes without considering diagnosis codes fails to meet the regulatory requirement for comprehensive claim submission. Healthcare payers require both the diagnosis and the procedure to justify medical necessity. This oversight can lead to claim denials and potential audits for incomplete or inaccurate information. Another incorrect approach that attempts to use diagnosis codes to describe procedures is a direct violation of coding guidelines and regulatory frameworks. Diagnosis codes are not designed to capture the details of services rendered, and their misuse can result in significant compliance issues, including fraud and abuse allegations. Finally, an approach that prioritizes a single coding system for all aspects of billing, without understanding the distinct functions of ICD-10-CM and CPT, ignores the established regulatory framework for medical billing and coding, leading to inaccurate data and noncompliance. Professionals should approach such situations by first identifying the core information required for a claim: what condition was treated, diagnosis, and what service was performed, procedure. They must then consult the official coding guidelines and payer policies to determine the appropriate coding system and specific codes for each piece of information. Continuous education and staying updated on coding system changes and regulatory updates are essential for maintaining proficiency and ensuring compliance. Question 16. Risk assessment procedures indicate that a significant portion of claim denial stem from issues identified during the patient registration and insurance verification process. A new patient presents for a scheduled appointment. Which of the following actions best mitigates the risk of future claim denials and ensures compliance with billing regulations? Option A. Inform the patient that they are responsible for all charges if their insurance does not cover the services, without independently verifying their coverage details. Option B. Utilize real-time electronic eligibility verification tools to confirm the patient's insurance coverage, benefits, and any required authorizations prior to rendering services. Option C. Obtain the patient's insurance card and manually enter the information into the billing system, assuming the provided details are accurate and complete for coverage. Option D. Collect the patient's insurance information and immediately proceed with the scheduled service, planning to verify eligibility and benefits after the appointment. The correct answer is D. Collect the patient's insurance information and immediately proceed with the scheduled service, planning to verify eligibility and benefits after the appointment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate need for patient care with the financial realities of healthcare billing and the legal requirements of insurance verification. A failure in patient registration or insurance verification can lead to claim denials, delayed payments, and potential financial hardship for both the patient and the provider. The billing and coding specialist must navigate these complexities while adhering to strict regulatory guidelines. Correct approach analysis. The correct approach emphasizes obtaining accurate and complete insurance information at the point of registration. This aligns with the principles of patient financial responsibility and provider revenue cycle management. By verifying eligibility and benefits upfront, the billing and coding specialist ensures that services rendered are covered by the patient's insurance plan, minimizing the risk of claim denials due to eligibility issues. This proactive measure is crucial for efficient claim submission and timely reimbursement, directly impacting the financial health of the practice and reducing administrative burden. It also sets clear expectations for the patient regarding their financial obligations. Incorrect approaches analysis. One incorrect approach involves proceeding with services without verifying insurance, assuming coverage will be confirmed later. This is a significant regulatory and ethical failure. It violates the principle of informed consent regarding financial responsibility and can lead to unexpected out-of-pocket costs for the patient, creating a negative patient experience and potential disputes. From a billing perspective, it increases the likelihood of claim denials for non-covered services or lack of prior authorization, leading to increased administrative costs for rework and collection efforts. Another incorrect approach is to rely solely on the patient's self-reported insurance information without independent verification. A patient input is a starting point. It is not a substitute for direct verification with the insurance carrier. This can lead to errors in coding and billing if the patient's understanding of their coverage is inaccurate, resulting in claim rejections and delays. Ethically, it places an undue burden on the patient to understand complex insurance policies and can lead to financial surprises. A third incorrect approach is to delay insurance verification until after the service has been rendered, only to discover eligibility issues. This is inefficient and costly. It delays the identification of potential problems, such as lack of coverage or the need for pre-authorization, which could have been addressed prior to the service. This can lead to claim denials that are difficult or impossible to appeal, resulting in the provider absorbing the cost of services or engaging in costly collection efforts against the patient. Professional reasoning. Professionals should adopt a systematic approach to patient registration and insurance verification. This involves establishing clear protocols for collecting demographic and insurance information at the time of scheduling or check-in. Utilizing real-time eligibility verification tools and cross-referencing information with insurance portals are essential steps. When discrepancies arise, the professional should communicate clearly with the patient about their coverage and financial responsibilities, exploring payment options or alternative arrangements if necessary. This proactive and transparent approach minimizes financial risks for all parties involved and ensures compliance with billing regulations. Question 17. Benchmark analysis indicates that a patient presents for a follow-up appointment for a previously diagnosed chronic condition. The physician's progress note states, patient here for routine follow-up of hypertension. Also notes mild shortness of breath, but no new workup planned for this today. The coder is tasked with assigning the appropriate ICD-10-CM code for this encounter. Option A. Code the symptom of shortness of breath as the principal diagnosis. Option B. Code both the chronic condition and the symptom, with the symptom as the principal diagnosis. Option C. Code the chronic condition as the principal diagnosis. Option D. Query the physician for clarification on the primary reason for the visit. The correct answer is C. Code the chronic condition as the principal diagnosis. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding where a physician's documentation is ambiguous regarding the primary reason for a patient encounter. The coder must interpret the documentation to assign the most accurate ICD-10-CM code, which directly impacts reimbursement, statistical reporting, and patient care tracking. The professional challenge lies in balancing the need for specificity with the limitations of the provided documentation, ensuring compliance with coding guidelines without making assumptions. Correct approach analysis. The correct approach involves identifying the condition that, according to the physician's documentation, occasioned the visit. In this case, the physician explicitly states the patient is presenting for a follow-up of a previously diagnosed condition, which is the primary reason for the encounter. This aligns with ICD-10-CM official guidelines for coding and reporting, which emphasize coding the reason for the encounter. Specifically, Section I.B.4 states, the selection of the principal diagnosis will be based on the provider's documentation of the reason for the encounter/admission. Therefore, coding the existing condition as the primary diagnosis is the most accurate and compliant approach. Incorrect approach is analysis. Assigning a code for the new symptom without sufficient documentation of it being the primary reason for the visit is a regulatory failure. ICD-10-CM guidelines require the principal diagnosis to be the condition chiefly responsible for the encounter. Coding a symptom when a definitive diagnosis is documented and is the reason for the visit violates this principle. This could lead to inaccurate data and potentially improper payment. Assigning a code for a condition not explicitly documented as the reason for the visit, even if it is a known comorbidity, is also a failure. While comorbidities are important for overall patient care, they are not coded as the principal diagnosis unless they are the primary reason for the encounter. This misrepresents the patient's current healthcare needs and the purpose of the visit. Failing to query the physician for clarification when documentation is ambiguous is a significant professional and ethical lapse. While coders are trained to interpret documentation, they are not authorized to make definitive clinical judgments or assumptions. When the documentation does not clearly indicate the primary reason for the encounter, a query is the appropriate step to obtain the necessary information for accurate coding. Adhering to the principle of documentation drives coding. Professional reasoning. Professionals should approach ambiguous documentation by first thoroughly reviewing all available clinical notes to identify the stated reason for the encounter. If the primary reason remains unclear, the next step is to consult the ICD-10-CM official guidelines for coding and reporting for relevant instructions. If the guidelines do not resolve the ambiguity, the professional decision-making process dictates querying the physician for clarification. This ensures accurate coding, compliance with regulations, and ethical practice by not making assumptions about patient conditions. Question 18. Regulatory review indicates a physician has requested a specific ICD-10-CM diagnosis code and CPT procedure code for a patient encounter. Upon reviewing the associated medical record, the certified billing and coding specialist identifies that the documented diagnoses and services do not fully support the requested codes, suggesting a potential mismatch between the provider's intent and the clinical documentation. What is the most appropriate course of action for the certified billing and coding specialist in this situation? Option A. Manually adjust the medical record documentation to align with the physician's requested codes. Option B. Assign the codes as requested by the physician to expedite the billing process and maintain physician satisfaction. Option C. Refuse to assign any codes for the encounter until the physician provides a written directive for specific codes. Option D. Query the physician for clarification and additional documentation to ensure accurate coding based on the medical record. The correct answer is D. Query the physician for clarification and additional documentation to ensure accurate coding based on the medical record. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in charge capture and coding, where a provider requests a specific code that may not accurately reflect the services rendered. The challenge lies in balancing the provider's request with the ethical and regulatory obligation to ensure accurate and compliant billing. Misrepresenting services can lead to significant financial penalties, reputational damage, and legal repercussions for both the individual coder and the healthcare organization. The coder must navigate the pressure to comply with a provider's request while upholding professional integrity and adherence to coding guidelines. Correct approach analysis. The correct approach involves a thorough review of the medical record to determine the most appropriate ICD-10-CM and CPT codes based on documented services, diagnoses, and procedures. If the provider's requested code does not align with the documentation, the coder has a professional and ethical responsibility to query the provider for clarification or additional documentation. This ensures that the final coded data accurately reflects the patient's condition and the services provided, adhering to the principle of documentation drives coding. This aligns with the fundamental principles of accurate medical record keeping and billing, as mandated by regulatory bodies like the Centers for Medicare and Medicaid Services, CMS, and professional coding standards. Incorrect approaches analysis. One incorrect approach is to blindly accept the provider's requested code without verifying it against the medical record. This bypasses the essential step of ensuring coding accuracy and compliance. It violates the ethical duty to code truthfully and the regulatory requirement to bill for services actually rendered and documented. This action could be construed as fraudulent if it leads to overbilling. Another incorrect approach is to attempt to force the documentation to fit the provider's requested code by altering or omitting details from the medical record. This is a severe ethical and regulatory violation, constituting falsification of medical records and fraudulent billing practices. It undermines the integrity of the entire healthcare system and patient care. A third incorrect approach is to refuse to code the encounter altogether due to the discrepancy, without attempting to resolve it. While caution is important, outright refusal without seeking clarification or further documentation is not a constructive or professional solution. It delays accurate billing and potentially disrupts patient care and revenue cycles without addressing the root cause of the discrepancy. Professional reasoning. Professionals facing this situation should follow a structured decision-making process. 1. Review the medical record thoroughly for all relevant documentation. 2. Identify the diagnoses, procedures, and services provided. 3. Compare the provider's requested code with the documented services and establish coding guidelines. 4. If a discrepancy exists, query the provider for clarification or additional documentation, citing specific areas of concern. 5. If the provider provides sufficient documentation to support a different code, update the coding accordingly. 6. If the provider insists on a code that is not supported by documentation, escalate the issue to a coding supervisor or compliance officer. 7. Maintain a clear and documented record of all queries and communications. Question 19. Compliance review shows a medical billing department consistently faces claim denials related to patient responsibility and coverage verification. The team's current workflow involves scheduling appointments, performing services, and then attempting to bill the insurance and patient. This has led to a significant increase in accounts receivable days and patient complaints regarding unexpected bills. Which of the following approaches best addresses the root cause of these issues and promotes efficient, compliant medical billing? Option A. Develop a standardized script for front desk staff to inform patients that their insurance will be billed, without detailing specific coverage or out-of-pocket costs. Option B. Increase the number of billing staff to expedite the processing of claims after services have been completed. Option C. Focus on appealing denied claims more aggressively to recover revenue, rather than altering the initial billing process. Option D. Implement a mandatory pre-service insurance verification process to confirm patient eligibility, benefits, and any patient financial responsibility before services are rendered. The correct answer is D. Implement a mandatory pre-service insurance verification process to confirm patient eligibility, benefits, and any patient financial responsibility before services are rendered. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the billing specialist to navigate the complex interplay between payer policies, patient financial responsibility, and the accurate representation of services rendered. Misinterpreting or misapplying these elements can lead to claim denials, patient dissatisfaction, and potential compliance issues. The need for precise documentation and adherence to established billing protocols is paramount. Correct approach analysis. The correct approach demonstrates a thorough understanding of medical billing principles and regulatory compliance. It prioritizes verifying insurance coverage and understanding patient benefits before service delivery. This proactive stance minimizes billing errors, reduces the likelihood of claim rejections, and ensures accurate patient financial responsibility is communicated. This aligns with the ethical obligation to provide transparent and accurate billing information to patients and payers, as well as the regulatory requirement to submit clean claims. Incorrect approaches analysis. One incorrect approach fails to verify insurance coverage, leading to potential billing errors and unexpected patient costs. This can violate payer agreements and patient rights regarding informed financial consent. Another incorrect approach focuses solely on submitting claims without considering the nuances of payer policies or patient benefits. This reactive approach increases the risk of denials and rework, impacting revenue cycle efficiency and potentially violating payer guidelines for claim submission. A third incorrect approach involves altering service codes to match payer expectations without reflecting the actual services provided. This is a direct violation of coding guidelines and can constitute fraudulent billing practices, leading to severe penalties. Professional reasoning. Professionals should approach medical billing by first understanding the patient's insurance coverage and benefits for the planned service. This involves verifying eligibility, understanding copays, deductibles, and coinsurance, and confirming if prior authorization is required. Subsequently, accurate coding based on documentation is essential, followed by a clear explanation of patient financial responsibility. Finally, timely and accurate claim submission according to payer specifications is critical. This systematic process ensures compliance, minimizes financial risk for both the provider and the patient, and upholds ethical billing standards. Question 20. The assessment process reveals that a patient presented for a routine physical examination and a follow-up appointment for a chronic condition on the same day. The patient provided an insurance card that appears to be for a managed care plan, but the specialist is unsure if the physical examination is considered preventive care under this specific plan, or if the chronic condition follow-up requires a different billing approach. The specialist also notes that the patient mentioned having secondary insurance coverage through a state-specific Medicaid program. Which of the following actions best represents the most appropriate and compliant course of action for the billing and coding specialist? Option A. Bill the physical examination as a preventive service under the managed care plan, and bill the chronic condition follow-up as a separate visit under the secondary Medicaid coverage. Assuming Medicaid will cover the follow-up. Option B. Verify the patient's primary insurance benefits for both the preventive physical and the chronic condition follow-up, noting any copays or deductibles. Then, verify the secondary Medicaid coverage for any remaining balance or services not covered by the primary plan, ensuring compliance with both payers' guidelines. Option C. Submit a single claim to the managed care plan for both services, coding them as separate encounters, and wait for their adjudication before addressing any secondary insurance. Option D. Bill the physical examination as a preventive service under the managed care plan, and bill the chronic condition follow-up as a separate visit under the managed care plan, assuming the managed care plan covers both services. The correct answer is B. Verify the patient's primary insurance benefits for both the preventive physical and the chronic condition follow-up, noting any copays or deductibles. Then, verify the secondary Medicaid coverage for any remaining balance or services not covered by the primary plan, ensuring compliance with both payers' guidelines. Explanation. This scenario is professionally challenging because it requires the billing and coding specialist to navigate the complexities of different insurance payer types and their specific coverage limitations, directly impacting patient care and financial responsibility. Accurate identification of the payer type is paramount to ensure correct claim submission, adherence to payer policies, and ultimately, appropriate reimbursement for services rendered. Failure to do so can lead to claim denials, delayed payments, and potential financial burdens for both the provider and the patient. The correct approach represents best professional practice because it prioritizes accurate identification of the payer type based on the patient's insurance card and verification of benefits. This aligns with the fundamental principles of medical billing and coding, which mandate adherence to payer-specific guidelines and regulations. By verifying benefits, the specialist confirms coverage for the specific service, understands any prior authorization requirements, and identifies patient financial responsibilities, thereby minimizing claim rejections and ensuring compliance with payer contracts and federal regulations like the Health Insurance Portability and Accountability Act, HIPAA, which governs the privacy and security of health information and necessitates accurate billing practices. An incorrect approach that involves submitting a claim without verifying the payer type or benefits is a significant regulatory and ethical failure. This demonstrates a lack of due diligence and a disregard for payer policies, which can lead to violations of payer contracts and potentially fraudulent billing practices if services are billed to a payer that does not cover them. Submitting claims based on assumptions rather than verified information can result in incorrect coding, billing for non-covered services, or failure to obtain necessary pre-authorizations, all of which can lead to claim denials and audits. Furthermore, it can result in patient dissatisfaction and financial hardship if they are unexpectedly billed for services they believed were covered. Another incorrect approach, such as assuming all government payers operate under identical rules, is also a critical failure. Each government payer, such as Medicare and Medicaid, has its own distinct set of regulations, coverage policies, and billing requirements. Failing to recognize these differences can lead to non-compliance with specific program rules, resulting in claim rejections and potential penalties. For instance, Medicare has specific guidelines for durable medical equipment, DME, that differ from Medicaid's policies in various states. The professional decision-making process for similar situations should involve a systematic approach. 1. Patient intake and insurance verification. Always obtain the patient's current insurance card and thoroughly verify their benefits with the payer. This includes confirming eligibility, coverage for the specific service, any co-pays, deductibles, or co-insurance amounts, and pre-authorization requirements. 2. Payer identification. Accurately identify the primary and secondary payer types, e.g., commercial insurance, Medicare, Medicaid, TRICARE, etc., based on the insurance card and verification. 3. Payer-specific guidelines. Consult and adhere to the specific billing and coding guidelines for the identified payer. This may involve referencing payer websites, provider manuals, or coding resources. 4. Documentation review. Ensure all documentation supports the services rendered and meets the requirements of the payer. 5. Claim submission. Submit the claim accurately and compliantly according to the payer's specifications. 6. Follow-up and denial management. Proactively follow up on claim status and address any denials promptly and correctly.